Okay, we can go ahead and start doing some questions and discussion.
Great. Thank you, Sheila. Thank you, Barbara. I'm also going to invite another one of our infection preventionists, Shantala Ahania, to join for the Q&A. There are a number of questions in the chat. I'll address the really easy ones. Can we get a copy of the slides and the recording? Yes, if you missed the announcement earlier, we will post the slides as well as a recording from this week's trainings on the Train the Trainer website. So make sure you bookmark that registration page. We'll link to all the toolkits and all of the materials that were shared today. So have that bookmarked for easy access, and then I'll turn it over to Shantala.
Can you hear me, Erin?
There you are. Yes, we can hear you.
Thank you. My Zoom gave me a glitch. Thank you, Barbara. Thank you, Sheila, for the great presentation. I will start with the first question. I'll bounce it back to Sheila. Sheila, if question regarding the criteria for who needs to be an ESP, there are a couple of questions. Whether any resident with an indwelling device without an MDRO should be placed in an ESP, if you can cover that.
Yes, of course. So yes, any patient, what we're doing with ESP is evaluating your resident's risk. So those risks, the two main risks are unhealed wounds and devices. So we don't necessarily focus on.
Okay, we can go ahead and start doing some questions and discussion.
Great. Thank you, Sheila. Thank you, Barbara. I'm also going to invite another one of our infection preventionists, Shantala Ahania, to join for the Q&A. There are a number of questions in the chat. I'll address the really easy ones. Can we get a copy of the slides and the recording? Yes, if you missed the announcement earlier, we will post the slides as well as a recording from this week's trainings on the Train the Trainer website. So make sure you bookmark that registration page. We'll link to all the toolkits and all of the materials that were shared today. So have that bookmarked for easy access, and then I'll turn it over to Shantala.
Can you hear me, Erin?
There you are. Yes, we can hear you.
Thank you. My Zoom gave me a glitch. Thank you, Barbara. Thank you, Sheila, for the great presentation. I will start with the first question. I'll bounce it back to Sheila. Sheila, if question regarding the criteria for who needs to be an ESP, there are a couple of questions. Whether any resident with an indwelling device without an MDRO should be placed in an ESP, if you can cover that.
Yes, of course. So yes, any patient, what we're doing with ESP is evaluating your resident's risk. So those risks, the two main risks are unhealed wounds and devices. So we don't necessarily focus on their MDRO status, particularly because many times that is unknown. So you want to focus on those two risk criteria, and devices are one. So the answer would be yes, if they have a device, they would be a candidate for ESP, regardless if they have an MDRO.
Thank you, Sheila. Next question to you, Barbara. What's the PPEs required if we are inserting an IV, or if for infusion, if the resident is on ESP, do we need to wear PPE?
Yes, definitely. So that is covered in that ESP document. There's a table in that document, I want to say on page 8 and 9, that you can review for that. But yes, you need to wear a gown and gloves for those types of medical treatments where you're very close up with the patient.
Thank you, Barbara. Sheila, the next question, we covered it yesterday, and I think they have a question again for dialysis shunt or fistula. So do they need to be on ESP?
Okay, thank you, Santala. No, patients on dialysis that have a fistula or a shunt do not need to be placed in ESP. Those devices are embedded and under the skin and usually have healed skin over them and therefore do not require ESP.
Thank you, Sheila. One more question to you, Sheila. Again, you question was on G-tube, and can they need? Do they need to be on ESP?
Okay, yes. So G-tube is one of those devices that were identified as being an indwelling device. So they do require to be in ESP. And that would also include a trach, a central line, and so forth.
Thank you, Sheila. There is so many many questions regarding the cohorting. We'll take that one by one. But the next question is, do we need to have an order for physician order to place the resident on ESP? And I will pass it on to Barbara. I think before that, there are few facilities have a few of the IPs have mentioned on the chat that they are adding that in their care plan. So with that, Barbara, go ahead and then answer that question, and then we can ask any of the IPs who is on the call, who can be, if you have already, if you have already implemented ESP in your facility, what is your process? If you can share your experience, that'll be great. Thank you, Barbara.
Yeah, so definitely putting it in the care plan. That is how you're planning for the care of your residents. So definitely documenting that on the care plan, as well as the assessing and reassessing that is occurring for ESP should be documented. And then as far as an MD order, bringing in your medical staff and having your medical director involved with this process is going to be one of the keys to success for your ESP implementation. So I would really encourage you to work with your medical staff in getting this implemented.
Thank you, Barbara. I think it's, I see couple of response on the chat that they do have an get a physician order with a care plan. So that may change as we are all learning more on ESP and including our survey, CDPS survey team. So if there is any change, we'll let you know. But right now, follow your facility to get an order and then make sure that they're on the care plan. The next few questions, Barbara, Sheila, it's regarding cohorting. Can we cohort a resident with with ESP with another resident with a standard precaution in the same room? Sheila, you want to take that?
Oh, sure. So yes, technically, you know, we do use standard precautions for all our residents, even those that are ESP. You still keep in mind your standard precautions. The only time it wouldn't be a good idea to cohort those are those residents that are on ESP but are colonized with an MDRO. Then those should not be cohorted together. Otherwise, you could.
Thank you, Sheila. So similar question, Barbara, can a resident with the indwelling device and with the ESP can be cohorted with an MDRO? So it's, I think the answer is similar what Sheila said, but I will pass it on to you.
Yeah, so if the reason that it depends on the reason. So if the reason is MDRO, then we would keep that resident with a similar MDRO resident. If they are being cohorted because of an indwelling device, then you could definitely cohort them with another indwelling device.
Thank you, Barbara. So to similar question to you, Barbara, for the, there was another question regarding history of ESBL. So do they need to be under ESP?
So yeah, so for a history of, you would follow your transmission-based precaution policy. So you should have a policy about what you're going to put in contact isolation or not. And then once you rule out the contact isolation, you would assess that patient for ESP if they had a indwelling device or a wound.
Thank you, Barbara. To add to that, so again, as you're developing your ESP plan or policy, making sure that this one of the guidance is also helping more resident focused, as Sheila mentioned, it's a resident focused care, not the germ focused care. So any of these MDRO residents who are on with the history who are colonized can be transitioned from a contact precaution to enhanced standard precaution. So, but you cannot just go and place them. You need to make sure that your policy, ESP policy, under your contact precaution, the transmission-based precaution policy is give you that reference. And the next question is regarding can an ESP patient share room with another patient? Sheila?
Yes, I think you're asking with another patient that shouldn't be on ESP, which is very similar to the response of standard precautions, because as you know, all the residents are on standard precautions. So that would still be okay as long as the other patient does not have colonization of an MDRO or an active infection with an MDRO. But so the simple answer is yes.
Thank you, Sheila. So one more question to you, Sheila, is would a resident with a stoma, be it a colostomy or ileostomy or urostomy, require ESP?
Okay, so those are those tricky questions, but they always come up, and it's great that you all are turning your wheels and asking those type of questions. So if those your colostomy and those mentioned are managed by the resident, then they're not technically considered a device that would fit the criteria for ESP. Those secretions, the excretions are contained and they don't require it. But if the patient does not manage their own colostomy, then you would go ahead and err on the side of caution and put them on ESP and use the personal protective equipment. But again, a colostomy in general is not considered an indwelling device that requires ESP. So then you would just use your standard precautions as necessary.
Thank you, Sheila. Barbara, a couple of questions regarding signage. The first question is where to place the signage. Do they need to place the signage outside the room? If you can go over the signage placement, and also if a resident is on a contact precaution, and do they need to be on ESP? I think the similar questions we had it yesterday. So if you want to, thank you.
Yeah, thank you, Shantala. So first off, a resident would not be on ESP and contact both. It's if they need contact, then they would be on contact precautions, and that would supersede ESP. But like we talked about a minute ago, you'll have a policy or a practice in place as far as when you're going to discontinue that contact isolation. And when you discontinue that, then you're going to need to assess that patient or resident for ESP, because maybe their reason for contact isolation has disappeared, but they still do now qualify for ESP. For example, let's see that they have a draining wound with an MRSA infection, and then they've had an amputation to eliminate that chronic draining wound. So now they don't need contact isolation, but do they qualify for ESP? So then you would have to assess to see if they qualify for ESP. And so this is an example of how we need to be always assessing our residents and then documenting in the care plan what to do. As far as signage goes, CDPH does not specify where the signage belongs. That is for your facility to determine. So your facility may determine we're already used to looking for a sign on the outside of the door. Let's keep it consistent, and then you can do that. Or maybe for ESP, you say, actually, because ESP is different from transmission-based precautions, we're going to put that sign at the head of the bed. Whichever way is allowed, not specified by CDPH, but as long as you and the staff in your facility and the physicians in your facility can speak to it, then that flexibility is allowed.
Thank you, Barbara. Barbara, do you want to just to mention about how the staff are getting confused with the signage about the six?
Yeah.
Can you go ahead?
There are 6 moments of ESP. Also, however, we all saw during the pandemic everywhere, even in stores and non-clinical settings, 6 feet of social distancing. So make sure that your staff can speak to the 6 moments of ESP, and that is different from 6 feet of social distancing, which I feel like that's kind of one of those pandemic, leftover responses, because we've been so conditional to think of a big 6 and on a sign to think of 6 feet social distancing. Like I say, I see this everywhere I go. I'm sure you do too, even in stores and whatnot. But the six we're talking about here is the moments of ESP, and you want to make sure that your staff is aware of that. Thank you.
Thank you, Barbara. Sheila, I think there is a if you want to cover a little bit about where they had to don PPE. So do they need to don the PPE prior to entering the room, or can they do it when they go to provide these 6 moments of care? And questions is coming up on whether they need to wear PPE if they're just going to ask a question. So if you want to cover that part.
Okay, sure. So yes, the PPE for residents and ESP should be donned in the room. There are many multi-bedrooms, so therefore there's the flexibility of donning the PPE or putting it on while you're in the room, particularly if you're going from resident to resident. So it is different from contact precautions that you should don it before you go in. For ESP, it should be done inside the room, and also removing it is done inside the room. Go ahead and discard it in your regular trash, and then put on another set of PPE if you're going to go to the next resident. In regards to tasks that perhaps may not require gowned because they're very quick, we do have a few exceptions, and Barbara did make mention of our guidance on ESP that was released in October. Please make reference to that, because there is a table there on page 8 that delineates those few exceptions, but it usually refers to taking in a meal tray, asking a question, turning off a quick question, turning off an alarm, something that you will not be in direct contact with the patient or their environment, because again, remember, their immediate environment is considered contaminated due to either a device and or draining wounds. So those tasks would be okay to only put on gloves. But yeah, become familiar with the tools available to you that will help answer those specific questions for you. Thank you.
Thank you, Sheila. This is another question which is similar to the PPE. I will pass it on to you before I go to Barbara. If a resident has a covered wound on their heel, do the CNAs need to wear PPE when performing a brief change if they're not having high contact with the wound or foot?
Okay, so it's sort of linked out when you said the wound, but it's just it's a wound, an unhealed wound on the heel, correct?
Mhm.
Okay.
It is covered. It is covered. They're looking at
Covered, but it's still unhealed. Okay, so remember, initially when you're assessing your patient, you're looking at those two main criteria. Do they have unhealed wounds, and do they have a device? From then you would do you would put them on ESP if either one of those are yes or both are yes, and then you would look at what type of activity you'll be doing with the patient, and changing their brief is a high contact activity. So you would to put on your PPE and your hand hygiene when you are working with the patient. Resident, I'm sorry.
Thank you, Sheila. I think there is a lot of question. I think it's confusion regarding only if they are touching the device or touching the wound, they had to wear PPE. It's more of a resident contact, and then the resident environment contact is where we are looking at for the ESP PPE requirement. Barbara, this question is for you. Is ESP is required or recommendation?
Yes, thank you. So AFL 22.21 says that enhanced standard precautions is recommended as a method for the prevention of MDRO transmission. So the AFL uses the word recommended. However, part of all of our responsibility in skilled nursing facilities and in all healthcare is to prevent the spread of MDROs in our facilities. So ESP being the recommended approach for MDRO transmission prevention is highly recommended, because if you're not using ESP, then the question is, what method are you using to accomplish this very necessary task? So I hope that answers the question. Again, I would strongly encourage you to look at AFL 22.21, and then if you're not, as a way to understand that what we're concerned about in CDPH and CDC is that we have an increase of these MDROs as a result of a variety of factors, which are too numerous to go into right now. But how are we going to control them in the skilled nursing environment? And so because we do have this really big increase of MDROs that we've seen over the last couple of years, we're rolling out ESP as a method for doing what we all know is a requirement, which is controlling the spread.
Thank you, Barbara. So I'll add one more question to you. It's a twofold question, but it's both. Do we need to, can they place a CRAB patient, CRAB positive resident in ESP? And also there's a, you go ahead and answer that, and then I will go with the second question.
Sure. So kind of not enough information in the question. So if a resident has CRAB, my first thing would be, well, is it an infection, an ongoing infection? Where is it? You know, do they need contact isolation? So hopefully you've got that delineated in policy. So if it's an ongoing infection, then they're just going to need to be placed in normal transmission-based precautions and isolation for contact. If it's a colonized CRAB patient, then we need to also ask, is it during an outbreak? So was this colonization recognized during a facility outbreak? So if there's no outbreak in the facility and it's a colonized patient, then you would assess that patient for ESP.
Thank you, Barbara. So the next question for you, Barbara, is CRS resident tested positive in the hospital. How long isolation will take place? Then after, do we need to place under ESP?
Pretty much the same answer. And also, you know, working with your county health department to see, you know, the prevalence of these various organisms, including crab and Canada auris, and their prevalence in your county will also determine whether or not that resident is going to stay on what precaution, you know, if it's going to be on contact or if we can transition to ESP. So working also in addition to what I said about crab, working with your local public health department on that as well. And they will know what the community prevalence is in your area.
Thank you, Barbara. Erin?
Yeah, there's a hand up in the chat or in the gallery, and so I wanted to invite Julianne. Is it De La Torre? If you want to unmute.
Hi there, how are you?
Good.
So my question is on regards to ESP. So from my understanding, when this was being rolled out, in addition to preventing MDROs, it was also supposed to help, as mentioned in the beginning, fatigue for our staff, as well as better mental health for those residents who feel more confined in their rooms because of isolation. My question is, here at my facility, over 50% or majority of the facility is going to require, yes, if that is the guidance that we are following to the T. And I have feedback from a lot of residents where they feel like they're just an infectious person at all times because we have to wear PPE, as well as majority of our staff being coming out of COVID are already feeling fatigue from PPE, but it just seems like this is an added requirement causing more usage of PPE rather than putting it back or, you know, less of it. So I'm wondering how we can continue with this guidance to help prevent MDROs, but use it more on a minimal basis since it is a strong recommendation and not a requirement. What advice would you have for us facilities that have this going on?
Well, I can begin to address that, and then I'm sure Shantala has some thoughts as well. Again, on page 5 of the document we've been referencing to on the toolkit called Enhanced Standard Precautions for Skilled Nursing Facilities, page 5 of that document talks about the transition from transmission-based precautions like contact isolation to ESP. So when you start thinking about your MDRO colonized residents, being able to look at an MDRO colonized resident, maybe like with an MRSA or a VRE or even an ESPL, and saying, oh, this is an MDRO colonized resident. Now let's not have them be on contact isolation. Perhaps let's look to see if ESP is appropriate for them, and maybe either yes or no. So you're going to also be able to move residents off of contact into ESP, which then does allow them to leave the room and that sort of thing. So I feel like that is going to be a way to go ahead and do, as we have said, ease the PPE burden and allow residents more freedom in the skilled nursing facility to move about. Shantala, Sheila?
Yeah, I was also just going to add to please keep in mind that ESP is not isolation. It may sound a little daunting with or similar to always have to use the PPE and the hand hygiene, but those are for those high risk activities, but it definitely allows for your patient to have visitors if they're not interacting with those type of activities, go into common areas as long as their wound drainage could be contained, where in contact isolation, this is not allowed. And again, if you bundle your activities, you can use less PPE by just a little preparation before you give care to the patient, to do all those activities at once, or as much as possible. And that would also lessen the burden of PPE usage. But anyone on ESP is not isolated to their room. So that's something just to please keep in mind.
Thank you, Sheila. Thank you, Barbara, for covering. Erin, did I miss any other hands? Anybody else has any question?
No hands right now, but if you do have a question and would like to come off mute, feel free to raise your hand or just come off mute and speak your question or comment. We welcome it.
Till then, so I'm going to cover a few more questions. Barbara, this question for you, it's what about resident on ESP working with therapy? Does it depend on the activity, or should all therapists working closely with these resident use gown and gloves?
So generally when going to an activity, you're going to have already put the resident in clean clothes. So considering that, however, if the physical therapist is going to be interacting with closely, then they may need to. So really, I feel like taking these moments to your physical therapy staff and saying, you know, the resident will have already been placed in clean clothing and had performed hand hygiene upon exiting the room. Would you need to, and then going to your, because different physical therapists do different work with the resident. So I think you're going to have to use a multidisciplinary team to answer this for your facility. But in general, I would ask them what exactly activity they're going to do, knowing that the resident has already been placed in clean clothes with hand hygiene performed upon exiting. And then also put that in your risk assessment and your policy. And again, that's part of why we recommend a multidisciplinary team to approach ESP, is because different facilities and different physical therapists do things differently.
Thank you, Barbara. Sheila, next couple of questions, and then I will pass it on to Erin. So do we need to have a dedicated barrels for linen and trash inside each ESP room?
No. The linens and trash is treated as regular linen and regular trash. There's no special precautions, no special bins.
Similar to the same line of question, do we need to provide patients on ESP with the disposable utensils?
No, that's not required either. They're not in isolation, and so that is not a recommendation.
Thank you, Sheila. Even for the contact precaution, residents, or even during COVID, CDPH and CDC never recommended that you had to have a disposable utensils for or no special handling for linen and laundry. So making sure that what you put in your policy, if you have included that there you'll be using disposable utensils, then the surveyors will be looking into what is in your policy. So there is one question regarding the survey, the surveyors. So I will answer that question, and then there's another question. Barbara, I will pass it on to you. So regarding the surveyors right now, so they're all looking at based upon what is your policy. If you have implemented ESP in your facility, they'll be looking at your policy. So any citation you may get, it was based upon your policy. So right now, that's what they're looking at, just like your contact precaution, just like any other transmission-based precautions. So there is no specific citation. It's more like they always follow your policy and procedure. Barbara, there is a question regarding, I think it's, it takes, I don't know how much time we have to cover it, but I will ask you to answer if possible. If we place any resident on ESP, how it is affecting their dignity or emotional well-being. So if you're able to cover that.
Yeah, so this will have to be the last question because I know we have a few housekeeping items at the end. So placing a resident on ESP should be done in a manner where the utmost dignity and respect of the individual is maintained. And I always will go back to overall resident safety, that they are on ESP because they have an indwelling medical device or they have a wound, which makes them more at risk for infection, which is why we're doing it. And so I would make sure that they're understanding that this is one of our patients' safety measures to keep them safe in the healthcare environment, and making sure that they understand it won't impede their ability to go out and socialize. It will only take, the care staff will only have to wear just a little bit more protective gear so that they are being handled in a manner which is safe and has been shown to reduce the risk of infectious disease transmission.
Thank you, Barbara. With that, there's several questions we could not answer right now, but we will be covering that in our office hours as well as our FAQ. It is coming up soon. So the first edition, there is a few more edition will be coming up. Tune for that, and more questions will be answered on our office during our office hours.